Nephrotic syndrome in children, causes, symptoms, treatment. Nephrotic syndrome in children is quite dangerous. Parents need to detect early signs early and take the child to the hospital early, avoiding complications. About 1 in 50,000 children has nephrotic syndrome each year. This condition usually occurs first in children aged 2 to 5 years old. Nephrotic syndrome in children. Nephrotic syndrome is a condition in which large amounts of protein, more specifically albumin, are lost through the urine. The amount of albumin lost is sufficient to cause a decrease in blood protein. On the other hand, protein has a water retention effect in the lumen. When the blood protein is low, water will drain from the lumen to the interstitial tissue and cause edema. Edema occurs in different areas of the body and at different times of the day. In particular, the most common areas include eyes, abdomen, 2 lower limbs and scrotum. When albumin is lost through urine, some special proteins, antibodies, are also lost. Antibodies play a very important role, helping the body fight off the attack of pathogenic bacteria. So children with nephrotic syndrome are at a higher risk of infection when they lose protein. In addition, anticoagulant factors may also be lost in the urine. Although coagulation is rare in children with nephrotic syndrome, but it happens in special cases, when children vomit and diarrhea is accompanied by severe dehydration. Causes of nephrotic syndrome in children. Currently, we still don't know the exact cause of nephrotic syndrome. It may be because the immune system is not working properly. Nephrotic syndrome in children is mainly idiopathic, accounting for 90% of children aged 1 to 10 years. Nephrotic syndrome cannot be passed from person to person. Very rarely, children in the same family have nephrotic syndrome. This only happens when the cause of nephrotic syndrome is due to a rare genetic mutation. Treatment of nephrotic syndrome in children. The doctor will check your baby's blood pressure, height and weight. Then the child needs to perform blood and urine tests for diagnosis. Will not draw too much blood from children and the body will make more to replace the blood just taken. When confirming a child with nephrotic syndrome, the doctor will often consider prescribing steroids for children such as prednisone and prednisolone. Most children, 80%, will respond to treatment, completely stopping protein status in the urine and not edema in the first 2 weeks. Nephrotic syndrome in children will gradually decrease when protein in urine is negative for 3 consecutive days. When the child appears edematous, the doctor will prescribe additional medication to reduce edema, usually a diuretic. When the symptoms of edema increase, the child will need to stay in the hospital and take diuretic or albumin infusion. Side effects when treating nephrotic syndrome in children. Prednisolone is usually prescribed for a short time so very few side effects can appear. However, some side effects may appear, such as children who get hungry faster led to faster weight gain. Change behaviors like being angry. Hypertension. Increase blood sugar. Stomach stimulation. The drug can cause minor cataracts but does not affect a child's vision. Although a child's bone is treated with prednisone, it will slightly reduce the amount of minerals when special tests are performed, bone density test. But children with nephrotic syndrome respond with prednisone, rarely with broken bones or bone damage. Therefore, the treatment of skeletal diseases of children with nephrotic syndrome is not different from other children. After the child is in remission during treatment with prednisone, child will eat the same foods as the other children. Some children will feel very hungry when treated with prednisone and gain a lot of weight. Therefore, children with nephrotic syndrome should use low-energy foods, such as vegetables and fruits when hungry, instead of eating high-energy foods such as chips, cookies, biscuits. Vaccinate children with nephrotic syndrome. Children should get all vaccines according to the vaccination program, except for live vaccines such as chickenpox, measles, tuberculosis. We will not use them during the treatment of children with high doses of prednisone, or any immunosuppressant other than prednisone. Children will get vaccinated after 1 month of stopping high-dose prednisone or lower the dose. However, parents must discuss carefully with the doctor before vaccinating the child. Watch for nephrotic syndrome in children at home. Check your baby's early morning urine with a urine dipstick. It will be very helpful for parents to monitor the child's illness at home. It is not necessary to test urine every morning, but parents should do it every 1 to 2 days. Especially, after children have used prednisone for 7 days or when they have improved their edema. When urine test results for 3 consecutive days have no proteinuria, or only traces, the disease gradually decreases. Early detection, proteinuria with a test strip reduces the severity of the relapse. When should take children to see a doctor? In case of relapse of the child, parents should take the child to see a doctor immediately. When a child has one of the following symptoms: fever, severe abdominal pain, edema or limb pain, vomiting or diarrhea. A protein score of 3+ for 3 consecutive days means the child has a recurrent kidney failure syndrome. Parents should take the child to the doctor to start again with prednisolone 2 mg per kilogram per day. Until the child is in remission, test the test for proteinuria or a trace for 3 days. Then reduce the dose of prednisone as directed by your doctor. When the child appears proteinuria only in 1 or 2 days, it is completely normal. When edema does not appear, there is no need to use prednisone again, and this phenomenon usually goes away on its own. Children exposed to chickenpox patients at risk of developing severe disease. So parents should pay attention to bring children to see a doctor within 24 hours after exposure. When treating with prednisone for a long time, children often need to increase the dose of prednisone each time they are sick. Therefore, it is necessary to consult a doctor when the child has any abnormal symptoms. Kidney care product for the whole family, improve kidney function naturally, free trial for 2 months. The link in the description. Thanks for watching. Do not forget to like, share and subscribe to watch new videos. Wish you and your family peace.